Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hey Soph, how are you today?
Hey Raquel, I'm really good. I'm looking forward to this conversation about laminitis and posture.
Yeah, it's going to be great. I think it's a really important one that we can recognize this earlier in our horses and prevent it. And it has a huge relationship to posture, which is why we want to chat about it today. And we're in our kind of
A
spring.
laminitis time of year.
So it's dried off a lot, but it was a pretty hefty laminitis time. And there's a lot of horses out there that, are subclinically kind of suffering, and we want to bring awareness to how you can recognize it in posture. So when we talk about like laminitis, like what actually is it?
So when you consider the word laminitis, itis means inflammation, and laminae is the structure that knits together the hoof capsule and the pedal bone, which is the bone that sits inside the hoof. It's the very last one at the end of the leg against the ground. And when you have laminitis, there is a reduction or a loss of integrity between the bone itself and the hoof wall. So they are less stable in their relationship to each other. And it's, there's really acute, subclinical, chronic laminitis. There's lots of different ways to view it. And there's variable presentations internally and externally when you view the hoof and the body.
Yeah, so you can have a horse that was completely fine yesterday and then all of a sudden, is showing signs of laminitis today, which we're going to talk about. Or you can have the ones that have had it previously and they're still, they're really prone to flare-ups, or, you're managing it ongoing. Or there's the ones that you just don't really know about, and that's the subclinical ones, where they just have a bit of foot pain, but it's not that obvious in terms of like a lameness, or the hoof itself might not look that obvious to have laminitis. And I think those are the difficult ones, because often we see things in their posture or in their behavior which could easily be mistaken for other things, and we're gonna go in and discuss that. And then, in terms of like, why is this so important in terms of posture? So, the posture is, which we've talked about a lot, but, the way that the body is held, and the body likes to be in its most balance, which is the most efficient way of standing. So it's using the least energy. It should be pretty easy for the horse. But the horse stands on its feet and the feet interact with the ground. And so if there's any discomfort or imbalance in those feet, it means there's going to be stress on the horse's posture. And it's going to reduce that efficiency, and just lead to a lot of different tension patterns in the body. And we were talking before about like, how we can recognize that in ourselves, even how can we recognize that, in ourselves as well, like,
And can relate to it, to have an understanding of the different ways that as you move and go about your own life, you can recognize that there are times when, such as wearing a different type of shoes, for a day, whether that's a pair of heels or you've had to be in hiking shoes or boots that are heavy. You know, there are so many things that we think, oh gosh, that was uncomfortable, that was twingy, or you've had to sit in the car all day and you've been in position. I personally have a friend, and we were talking about how she had sat on a flight from Ireland to here in Australia, and that many hours on the plane, she'd sort of had, with her short little legs, she'd had her toes on the floor, slightly propping up um, her her feet with her calves in a bit of tension for nearly that whole time while she was sitting there on her computer. And when she got to Australia, she went for a little walk around Sydney and had the most painful calves she'd ever had in her life, and said, I didn't realize that being in that level of, you know, of unbalanced tension,
Yeah,
a lot of
also,
time, even though she wasn't under a huge amount of load, but it was different to how she would normally move, and it wasn't very functional, and there wasn't any movement in the tension. You know, she wasn't walking around and using them. She was sitting there stagnant with a little bit of contraction for a prolonged period of time, and then trying to go out and use those muscles. It was just, yeah, it was very difficult for her, and it's easy to see why, and that's how we can relate to our horses and the experience they're having.
yeah, I mean, that's why in humans too, like we have podiatrists and stuff because of that influence of the hoof of our foot, sorry, like on our body. So the hoof influence on the horse is even bigger because they spend so much time standing compared to us. Like they can spend, up to 22 hours standing. So that's so important. Whereas, we're doing a lot more sitting, a lot of different variations in movement to often what they are. So, it does kind of lead us over into the signs that we can look for in the standing horse that they could have laminitis. So whether it's, like really acute, really painful laminitis versus that more chronic aspect. So like I've seen a fair few like acute, painful laminitic cases, and like they'll have that really kind of rocked back, what we call camped out in front stance, where their front legs are like out in front of them. They're bracing their head and neck up, and they're really trying to get off those front feet, and their whole back is under tension. Their hind end, like you feel them, and their body's just like rock hard. So, that's more like acute. The pain in their feet is a lot. But then we get, the more subtle signs. So, like, what are some of the things that you've seen, just more subtly that could indicate there's underlying laminitis? And obviously, there's potential for other underlying causes of foot pain
Yeah.
or foot imbalances, but we're talking more about laminitis, like thinking about laminitis today. So, what other more subtle signs have you seen?
Horses that have possibly a bit of discomfort in their trim, they might react to being shod. That might incur, when the nail is being tapped into the hoof, or they're being asked to stand for a prolonged period of time on the opposite foot. That's really difficult for them. And also, when a hoof has been trimmed, sometimes there's a rush of blood, has been, they've done studies that there's a rush of blood in there, and there is an understanding that there's a possible discomfort from reperfusion pain as well. So, those little things, if your horse is antsy on the last foot, it's possible that the other three are going through a phase right now after their trim. I remember working and holding feet for the farrier, and they call it last hoofitis, but there's probably a reason for it.
Mm.
And that's one consideration. Another can be horses that are camped out in front or behind. And it's important to recognize that these little signs, when you've got what you would describe as subclinical or low grade chronic that isn't being noticed, sometimes it's present and sometimes it isn't. And that depends on the factors the horses are experiencing that influence the hoof, diet, time of day, exercise, etc. So you might not see them all the time, but they're little things that might be indicators. Toe pointing, and picking up the
Toe
opposite.
pointing's usually more acute. or, you know, there's an underlying abscess, like.
Oh, you're talking about like putting them right out in front with the toe
Yeah,
pointing.
where they'll just hold one foot like out and they'll kind of have it pointing like on their toe. So they might be just, so, you know, often that's a bit more of an acute sign, or there's an underlying abscess, which these horses tend to get a fair bit of abscessing just due to that altered circulation and lymph flow and function in the foot. Yeah, and the other aspects, like you talked about the comfort when trimming, but sometimes you'll notice them pick up the other feet. Like you'll put down, say, the left front, and then you'll notice they kind of pick up the right front. And I think that's when it's like, oh, it's feeling a bit uncomfortable, or maybe it's relating to some of that reperfusion as well, especially if that's just been trimmed. So you want to kind of know your horse's, you know, normal responses to those things, like, and also you need to look at the horse's facial expressions, because like you'll see those chronically laminitic ponies and like they've just got a lot of scrunched, a little scrunchness in their little faces, you know, like a lot of scrunchness in their lips and wrinkles around their eyes, their ears, you know, there's signs of that pain face, and it's consistent. And you'll see it just when they're standing around.
Yeah.
So then we want to talk about like, oh, and the one thing we just forgot too, like I talked about the bracing in acute, but in chronic, like you just might have this horse that, you know, is always tight in the pole. And the body worker comes and they treat the pole, but it comes back all the time. Or the same with the back and the hind end, like like the body worker comes and addresses it, but it comes back again. And it might be that they just got this underlying, like you said, you know, it can be variable. They just have this underlying posture that they're in this constant brace, but it can be anything from super obvious to actually not that obvious.
Yeah. And if you were to consider these, you know, body signs of laminitis, especially if you're considering movement, what else would you see?
I think the biggest one for me is the contraction of the abdominals. So whenever I see that in a horse, and what you'll see, it's the line along the belly, and it kind of runs from, I guess, elbow towards the pelvis, along the bottom of the rib cage. And if you see a horse, especially when they turn or put on a smaller circle, that contraction line going through the abdominals, the one thing I'm always thinking about when I see that is hoof comfort. It is not a line of activation of the abdominals, it's a line of pain.
Yeah.
And so it could be other pain, it could be abdominal pain, it could be other limb pain, but until proven otherwise, it's foot pain.
Right.
That's a huge one for me. Like, you know, I've had chronically laminitic horses where they're like, I think the feet are comfortable, but the horse is still showing this contracted abdominals. When they've done a lot of work to get the feet even more comfortable, it goes away.
Yep. So it's a really big indicator that people can be watching for.
Yep. So if you're seeing that, especially when you put them on a small circle, because what you're doing on a small circle is you're really loading up the inside feet, so the front and back foot on the inside, and so that'll show it up more.
Right. Right. And so other signs that you can see might be the choppy stride, which and also is going to be exaggerated, as you were saying, on a circle, because limbs that you're loading are going to become even more sensitive.
Yeah, and they can look like they've got a straight-legged movement in front, you know, with that short choppy stride. So it almost, yeah, looks like they're a bit peg-legged with the front legs. And it's just because they're trying to constantly hold themselves off those feet.
Yes. Yeah, which can also link to a reluctance to move forward because it's uncomfortable. So if you're seeing that, you know, either a combination of these signs or you're seeing reluctance to go forward, it's worth investigating further, you know, hoof comfort and observing what's going on there. You talked a little bit about bracing through the neck, but there's also the black back and especially the gluteals. They have
The rub.
yeah.
Yeah.
Yeah. across the top of, yeah, the rump. And that's generally due to muscle loading changes.
Yeah, so they're
Because,
taking their weight off the front end, loading up, and their back is bracing, their hind end is bracing to shift that weight. Because laminitis is most commonly in the front feet, but they can get it in the back feet. But often the horse is designed to load those front feet. You know, there's more load that goes into the front feet, so it's more obvious when it's in the front feet.
yeah,
And the one other thing I'd add there with the body signs is that they'll often look like they have really tight tendons. You know, so you'll really see the lower limb tendons and the muscles above that, so above the knee to the elbow, they'll often be like super tight because they're the muscles that connect to those tendons. So yeah, you might just see the tendons are really obvious and the muscles above them are super tight.
yeah. So if we've gone into body signs of laminitis, moving and standing, and you think about hoof signs that people can observe, there are lots of different things that you can see. One of them are event lines on the hoof. You can see that quite obviously. And there's
I think we actually probably need to break it down here a little bit into more acute signs and more chronic signs. Because the event lines are more chronic, right? Like you've got that, you've had stress, it's created the event line. But so that's a more like chronic indication that there's been underlying laminitic events or stress events, as opposed to that more acute one, which we'd see like a digital pulse, which is in the blood vessels just around the back of the fetlock there. Like you can cup that area and feel a pulsing. You'll get a little bit of, you'll be able to feel a slight pulse in a barefoot horse, but if it's bounding, then that with heat in the hoof is going to be, you know, like you've got an acute flare up. So knowing your horse's pulses, knowing their temperature of their feet is like really important.
valuable.
And if we go back to those event lines, so if you want to explain a bit more about what you'll see in the hoof wall as a bit more of a ongoing relationship to laminitis, like they've had it for a bit longer.
Yeah, you can have different types of lines that, event lines are a growth coming down through the hoof wall that looks like an uneven pattern. So it might look like a little bump or a mini depression that's growing down from the hoof wall in a line around the hoof parallel to the coronet band.
Yeah.
And so as it comes down, you can see it, and it'll grow from the coronet band all the way down to the hoof as the hoof wall descends. But you can also have an acute event that's occurring, and you'll see a line that doesn't follow a line that's parallel to the coronet band. So it drops down further at the heels, and sometimes it's a larger depression as well as it grows down. And sometimes you'll see bruising in that line. You'll see that it looks uneven and bumpy. And there's often swelling at the coronet band to go along with an acute phase as well as that's happening. What else would you add to that?
Yeah, I think it's just with the event lines, like making it clear, like there's stress lines. Every horse can have a stress line, right? Like, you know, I remember once I took Henry away for the very first time, and we were staying somewhere else for a few days, so a change in environment, change in nutrition, change in loading, and he got a stress line, as opposed to lines which you were talking about that diverge away from the heel. That's chronic laminitis. You know, so when you take an x-ray of that, you're probably going to have a change in the hoof bone alignment with the hoof wall. So more, you know, there's a balance change between the bone and the hoof wall, and that's where you're getting that divergence of the lines away from the heel because the whole balance has changed, as opposed to a horse that's just had stress where the alignment of the bone and the hoof wall is fine. It's just it's caused a bit of a, you know, change in circulation within the hoof, and
Yep.
so they've got that stress line. So, you know, that's one thing you can look for to see if your horse is kind of showing chronic signs, is that divergent line.
Yep. And while you're on the topic of acute and chronic, when you pick up the hoof and you look from below, you can observe at the point where the sole becomes the wall and there's a line around the outside of the hoof, and you can see the division between the structures. There can be you can see the laminar line there, and that's the connection we were talking about that connects the capsule to the bone. When there's been a chronic laminitis, it takes time for the laminar line to also grow out with the hoof as it descends, and you can see that it becomes stretched, and you can see it looks like a zipper between the wall and the hoof sole, and so the zipper looks very long and stretched between those spaces, and you can understand that there has been a somewhat chronic event, and you know the space between those structures has increased, and the body is filling it with intertubular horn as the lamina stretches. You like it to try and create some more structure for that hoof wall, because it's losing its integrity. And other acute signs that you can see, or once the hoof is entered a more serious stage of laminitis, is that you can see a dropped bulging or convex sole. So when you pick it up, it doesn't look like a beautiful concave sole, and it indicates
Acute or chronic sign, do you mean?
acute, but also and chronic. It's more of the stage where the laminitis is at. It's progressed to the point where the bone is very close to the ground. There's not a lot of sole in between.
Lost a lot of integrity.
Yes, yeah, and that's there as well. And you can see, and when it reaches a very serious stage, you can have penetration of the bone through the sole, and that's often when you've had that change in alignment of the bone to the hoof wall, like you were talking about, when you see that really big divergent line around the hoof.
Yeah, and often when you've got that not the divergent line, often when you've got that separation underneath, like where you're talking about the zipper line of the laminae or the white line, or you'll also see a flare in the hoof wall that can be associated with that as well. So if you look at the growth of the hoof down from the coronet band, it won't follow that line, it'll flare out. And so that can be associated with that separation too. So, and then it's tying that in with posture and how the horse is standing and the comfort, and it's always looking at all the signs, not just the hoof, not just the body, not just their behavior, not just the way they're standing, not just the way they're moving. Like putting all of those signs together gives you so much more information, and not always discounting the way that they behave during getting their feet done. I
Yep.
think a lot of things are put down to behavior with the feet when they're getting their feet done, like they're just misbehaving. But whenever my horses are struggling getting their feet done, I could tell you exactly why they're struggling on that day. Whether it's hoof pain, whether it's body pain, whether it's the ground is now really hard. Apart from flies, that's just an annoying reason that horses will struggle when they're getting their feet done. But I can tell you every time they are struggling with a foot, that a lot of the times there's a discomfort, restriction, or pain associated with that. So don't discount your horse's behavior completely. Training is important, but they have no other way to communicate with us, really. So, and some horses are amazing, they'll just put up with it. Like I watched Patch one day when her feet were really sore. She knew not to put that foot down. So what did she do? She tucked her back legs right up, so her back legs were nearly right under her belly, and she tucked her other front leg so it was like right under her belly as well. So she was basically standing on a pedestal, because she knew that she was not allowed to put that foot down. And in the end, I had to say to the trimmer, please, can you please give her a break? Because she's not going to ask for it. Whereas Henry, he will say, I'm uncomfortable, and he'll just pull his foot away. So, you know, some horses put up with a lot, and other horses are like, don't put up with hardly any discomfort, especially the more they're allowed to communicate, they'll put up with a lot less. But just be aware, if your horse is standing in a really weird posture when they're being trimmed and they've been trained to stand still, they might be, they're just trying to find that most comfortable position. So just be really aware of that. A comfortable horse will be happy to stand in a balanced posture with legs like coming down from the body when they're having their feet done.
Yeah, absolutely. And of course, you had mentioned earlier talking about abscessing in horses who have laminitis.
Yeah, they often can abscess more often, more commonly. I think, you know, there's a circulation problem there. If you're getting a lot of abscessing, then you need to look at the general circulation of that foot, which might be influenced by laminitis or other loading issues that are altering the circulation in that foot, or metabolic health as well.
So we've talked about the hoof and standing postures, and talking about further about how it affects the posture and their functional postures. You talked about the tension of the tendons and the muscle bellies of those tendons between the knee and the elbow. And of course, the horse having a reluctance to move or having a choppy movement. So there are other flow-on effects for the body and the posture, and that includes, you know, the fact that a horse that's designed to move and isn't moving enough, horses often experience stiffness. When that happens, they're not opening and closing their joints, which promotes joint fluid, and not lengthening and contracting their muscles normally, which improves lymphatic flow throughout the body, which is, you know, the movement of fluid and water throughout the body, and also their circulation. So those ongoing effects are going to have an impact in your horse's comfort as well. And you can see that in their body.
Yeah, 100%. And I mean, movement's just so important. So when you've got that reduction of movement due to discomfort, yeah, you're going to have a lot of flow on effects of that. And, you know, in the acute stages, we generally don't want to move them because we need to settle down that inflammation. And actually, you know, I think there was a recent study come out that just said don't move them in those acute phases, you know, icing. And I mean, we're not going into the management of them in this podcast right now, but like, you know, icing, not moving. But then in your more chronic laminitic cases, you want to move them because you want to promote circulation and health within those hoof structures. You want the fascial system to be actively working and get hydrated, and the joints, you know, so you need to, you know, be aware of the different types of management for the different stages. But at the end of the day, like, the most important thing is knowing your horse.
Yep.
Like, yeah, knowing your individual signs, because we could both have laminitic horses, but like your horse's flare up or your horse's chronic signs could be quite different to mine.
Yep.
You know? So like, what's some of the things that are going to influence that, our horses you know, differences?
So that's going to be everything from the sensitivity to their diet, whether they're shod or barefoot, if they have any comorbidities, how much work they're doing and how they respond to work, and other stress factors as well. You know, are there things that stress your horse more than mine, such as being separated from their friends, like you're talking about with Henry, or having a change in diet, rainfall and weather affecting the grass, and how they respond to those factors might be related to which of those factors are influencing their feet stronger.
Yeah, and I think also just thought of something else. So you talked about barefoot versus shod, diet management. Oh, that's what I was thinking of, surfaces. You know, so what surfaces they're standing on, what
Yep.
surfaces they're being worked on, how much concussion. And you talked about shod versus barefoot. That can have a huge impact on like the forces that are going through the foot.
Yes. And whether they're booted as well. You know, boots are such a valuable tool in hoof care.
Yeah. So I can tell, like with Jelly, now he doesn't have, you know, he's not a laminitic horse, but he was transitioned out of shoes to barefoot. And I guess we, you know, we're even just talking about hoof pain here. And I can tell when his feet are a bit sore because he just won't feel like he's striding out in front. So like I'll just lose a smoothness in the gait and he'll just start to just offload his front feet a little bit, and then because my ground here gets really hard, I don't have an arena. So, you know, at certain times of the year, I have to boot him to ride him, but at other times I don't have to boot him to ride him. And I can feel that.
Yeah.
So, you know, really like learning how to feel that within your horse and learning how to recognize those subtle signs. Like he doesn't do anything. It's not that obvious. I just see just his quality of movement is slightly altered.
Yeah.
So I think it's really important to kind of just know your horse, know what a healthy foot is, know that you're working towards a healthy foot, you know, have the discussions with your vet, with your nutritionist, with your hoof care provider, with your body worker, you know, like is there anything here that we need to look at? Are they showing any inflammation today in the trim? Has anything changed? Is our angles okay, you know, so that we've got appropriate loading? Am I managing the diet, reducing stress, you know, controlling those risk factors as much as possible, because it's your responsibility as the owner to recognize early signs, to know what you're looking for, to know what's normal for your horse in terms of digital pulses and heat. And yeah, and know when you need to make a change because you've got these subtle signs. If you can pick it up then in subtle differences in posture and all those little subtle signs we just talked about, like, you know, you're going to be way better off, especially like my clients who have laminitic horses. They're so good at recognizing like the little changes in their horse, and they're like, oh crap,
Yes.
I need to change this quickly. So yeah, I mean, I have had clients where they've had a mechanical cause of laminitis where a sudden change has created a laminitic episode. That's a little bit different. You can't, you know, there was probably chronic signs there that set the horse up for that acute episode, but they'll just switch like that overnight.
Yes.
So there are those ones, but there's a lot of like chronic subclinical ones out there where you can recognize those subtle changes.
Yes. Yeah.
Anything else to add before we?
I don't think so. That's probably enough information to digest. And I know we'll have more episodes on hoof care and hopefully possibly even guests in the future.
Yeah, definitely. Like it's so important, and
it really is.
Definitely going to talk a lot more about hoof balance and posture, but laminitis is, yeah, it's common. It's commonly mild, but it commonly has a huge impact on posture, performance, comfort, and
well-being and welfare. Yeah.
Yeah, welfare, you know, pain and discomfort. So yeah, just learn those subtle signs of changes in your horse's posture. You cannot know what's normal for your horse enough is probably a big takeaway in all aspects of that. So yeah, thanks for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and find the links to our socials in the comments, you know, such as the next Equine Functional Posture course. Yeah, thank you.
See you in the next episode.